I will be demonstrating what cervical incompetence is and the treatment of cervical incompetence. Cervical incompetence is one of the major causes of pregnancy losses. It usually occurs around the mid-trimester and is a major cause of distress for women, families, and communities at large. Just imagine a woman who just became pregnant, jubilating, and all of a sudden she loses the pregnancy. As if that's the end of the story. She becomes pregnant again around about 13, 14, 15, 16, 18, 20 weeks. She loses the pregnancy again. It is heartbreaking and disheartening. And the worst of it all is that a lot of people in our environment will misinterpret this scenario as an evil spirit. Some persons may think it is the mother-in-law that is responsible for this kind of pregnancy loss. Some persons might think it's a spiritual attack and all that. And that is the main reason I want to explain this on the board. Typically, cervical incompetence or cervical insufficiency is an abnormality of the function of the cervix, which could be physiological or it could be anatomical defect. So from here down to this place is the cervix. That is where we call the cervix. From here down to this place is the vagina. Okay, so when you have shortening of the cervix, shortening of the cervix, when you have shortening of the cervix, shortening of cervix, okay, when the cervix becomes too short, especially when it is less than 2.5 centimeter, it becomes short. In some patients, you might see less than 2 centimeter, it becomes too short. Okay, shortening of the cervix for any reason is one major cause of cervical insufficiency, or incompetence. Now, you might wonder where a woman, or what can cause shortening of the cervix in a woman. What can cause shortening of the cervix? There are deliberate, factors that can be iatrogenic in the woman. That means that because of the kind of treatment a patient has received, it can result in shortening of the cervix. It can also be natural, it can be congenital. Meaning that a woman is born with it. Okay, it can be iatrogenic. Okay, what that means is that, for instance, if a woman has received a treatment for premalignant lesion, treatment for premalignant lesion, okay, like cone biopsy, lip and leads. These are factors that can make the cervix to be short. Now, the other factor that can make the patient to have cervical incompetence is when there is trauma of the cervix. For instance, in women who have given birth in the past, especially unguided delivery, especially women that have deliveries at home and all that, the cervix can be traumatized and be damaged. Okay, trauma of the cervix during delivery. Deliveries that are not well guided can be traumatized, and at the end, when the patient wants to conceive again, there will now be difficulty. The patient will develop cervical insufficiency or cervical incompetence, such that if the woman becomes pregnant by around 12, 14, 15, 17, 18 weeks, 20 weeks, the woman will lose the pregnancy. Okay? Having stated the causes of cervical incompetence, the other one is dilatation and curettage is still under trauma to the cervix. Usually, when women are pregnant, some of them may terminate their own. All right. So the idea of dilating the cervix can be forceful, and once that dilatation happens here, it can traumatize the cervix, and the patient will now develop cervical incompetence later. So D and C, is another thing that can cause trauma to the cervix and can result in cervical insufficiency or cervical incompetence. So in the next video, I'm going to show you what really is the treatment of cervical incompetence or cervical insufficiency. Okay? So if you've learned something about this video, please share it.